Hey everyone, thanks for joining me. This is Stephanie here at the Clay County Health Department. I really wanted to address some of the questions that I've been receiving over the last 24 hours that really look at the restriction lifting, both at the statewide level as well as local. I'm going to talk a little bit about how those decisions are made, some of the things that are looked at when making those decisions. I'm going to show you how to be able to monitor those metrics on your own at home. And then also talk about how Clay County is working towards the phases of restriction lifting. It is going to be a little bit longer of a video than we are used to doing, so I will try to speak a little bit more fast than usual, but it will be listed at the end, the best way to contact us to answer any other questions that you may have. The first thing I wanted to go over with you is a really great infographic that breaks down the state's approach to easing those restrictions in a phased manner. So on the left-hand side of the screen, you'll see some of the variables that they take into account when looking at our data. So the state is wanting to see how many percent positive tests that are coming out of our hospitals. Also looking at how many people are presenting to hospitals that have COVID-like symptoms. Okay, so how many people are showing up with respiratory concerns, with even influenza-like illnesses, anything that is syndromic or anything that shows symptoms of COVID-19 is something that the state looks at. We also look at how many active current cases that we have that are positive, and then we look at the hospital's ability to respond and react to any potential surge in patient needs. So we want to be sure that we've got adequate personal protective equipment available for our healthcare workers, and we want to be sure also that we are increasing our ability to not only test, but then to conduct contact tracing. I'll talk a little bit more about that as we proceed. So the governor and his team sit down and they look at all these different variables and they say, okay, based off of our trends and our trajectory over the last 14 days, how can we begin this process in the safest way possible? So you'll see phase 1, phase 2, and phase 3 listed out. And it says under each phase, the benchmarks that they want to see achieved. It says, 2 to 3 weeks after phase 1 and continued improvement in virus trends. And then at least 4 to 6 weeks after phase 2 and continued improvement in virus trends. So it does indicate that it is going to be a long process, but working together, I know that it is something that we won't have a problem doing, especially here in Clay County. We've had a lot of great teamwork and a lot of proactiveness, and I couldn't be more proud of, I know, my team as well as our leadership throughout the county being able to come together and take care of you. So another thing that they do, I wanted to show you kind of a trending graph, right? So at the practical level, what are the leadership teams looking at to say, yes, we can say that we have a decrease in these variable areas? So here's an example looking at reporting emergency rooms across the state. So all counties are represented for the number of COVID-19 ICD code as well as keywords, right? So in effect, these could be positives or presumptive positives. So when we're looking, we see it goes up and down, up and down, up and down. Well, here we're going to take our highest peak with our star, and we're going to follow that trend. So we see it declining, declining. This is pretty good. Maybe some stabilization, and then, oh, that's awesome, right? We like to see in that. Oh, even better. And then, oh, what happened here? And then we go back down. So it's things like this that cause a little bit of concern and may make us start over with 14 days again. So just so you're aware, we want to see continual decline over a span of at least 14 days, and then also maybe a sustainability. So no peaks, and then moving forward. All right, so how can you monitor this data? First and foremost, I'm going to say this because we have gotten a lot of comments about how the state dashboard looks different than our dashboard. Our dashboard may look different than Cherokee County's dashboard, however that looks, there's been a lot of concern over the numbers matching and how that all comes together. And the best way I can describe it is this. So almost every dashboard has its own definition of what that data means, okay? So here on this slide, you can see a little bit about how the data was compiled for this particular dashboard. And this particular dashboard that I'm about to take you to are looking at the specific metrics for that phasing process. And the way that they put in those numbers looks different than any of the other dashboards. And a lot of that just has to do with the way things are reported or the way that they define how they are being measured. Okay, so I'm going to bring up the actual website and show you how you can go through it on your own. All right, so this is what the main dashboard looks like. You see that it is updated daily by 11 a.m. and then it gives the date. It talks about the laboratory confirmed cases, the deaths, completed tests, currently hospitalized, and then the number of counties. If we scroll down a bit, you're going to see a lot of other tabs. And I specifically had it on this about the data tab first. So if you're wondering why these numbers are different, why do these look differently than some of the other dashboards that you've been seeing? Well, this is the reason why, okay? So it tells you how it compiles the data, from what areas, and then any possible deficiencies or problems. So people who had minimal or no symptoms and were not tested, people who had symptoms but did not seek medical care, people who sought medical care but were not tested, and then people with COVID-19 in whom the virus was not detected by testing. So these may not be included in the laboratory confirmed cases. So as you go through, you can kind of read that on your own as to why things are showing up maybe differently on this dashboard than in others. I'll talk about Clay County's dashboard specifically here in just a bit. The other way that you can break down on this tab, going from this area here into more of the nitty-gritties, you can just click on that. It'll show you by age, the laboratory confirmed cases by age, the COVID-19 deaths by age, and then by race and ethnicity, gender, and cases over time. The other thing I mentioned earlier was the variable on personal protective equipment. So what this shows is breaking down the different types of personal protective equipment. It shows how much of that particular piece of equipment was requested and then how much was able to be granted. And this is through either the Strategic National Stockpile or through other manufacturer entities, through healthcare coalitions. It's a lot of information. So just to keep it easy, I wanted to show you this graph and how that's calculated. All right. So moving on, let's talk about our dashboard. One of the questions we have gotten continually is looking at how come these numbers don't add up? Well, right down here in the bottom right-hand corner, it says the numbers reflected will not add up to the number tested due to pending results and confirmations. So while we may have a number tested of Clay County residents, we've only received confirmation of this many negatives and this many positives, meaning any deficiencies would be because we are waiting for the pending results and confirmations to come through. Another thing that I wanted to point out about our dashboard that is different than some of the others that you may have been seeing. So I use this area to talk about any sort of public service announcements, any sort of changes that you may see, but then also to celebrate our wins. So you can tell on the 21st we had 3 more negatives come through, and our laboratory test turnaround decreased to only 24 hours. At one point it was upwards of 12, 13 days before we were getting our test results back. So this was an incredible win for the county and something that we were really excited to share with you. Earlier, that first slide that I showed you, it talked about our ability to boost up our contact tracing efforts, especially in areas that are more hard hit. But what is happening is they're hiring close to 500 people to assist public health with contact tracing efforts. And the website you can go to for that if you're interested in learning more is communitycarenc.org. And they are looking for people that live in the community in which they'll serve. They do want to give preference to those that are currently unemployed as a result of COVID-19. And then also individuals that have community engagement experience, because you're going to be doing a lot of talking. All right, so what now? What is the state saying as far as easing restrictions? Well, we're told on May 8th, we're going to be learning more information about the phase structure and how we can progress. So locally, I wanted to talk about what has been going on over the last couple of days, started last week, and talk more about what we are doing as a health department to address those concerns and be sure that we're doing so in the safest way possible for all of our community members. So on Friday, April 24th, we met with a lot of other county leadership as well as Dr. Peck with our Board of Commissioners. And we really discussed what this soft open would look like for us and how we could ensure that we were doing what we needed to do to stay consistent with CDC recommendations and be sure that we were prepared for whatever may come. So on the 24th, it was decided that effective May 1st at 12 a.m., there was going to be amendments to the local state of emergency recommending the temporary closure of businesses related to non-essential travel of non-resident individuals in Clay County. So what does that mean? So that means that the state never said that we had to close down or cease any of those lodging facilities. And it was by extra special measure and concern for safety. Clay County leadership decided to limit for essential only for lodging. But again, as of effective on the 1st, that has been lifted. You see to the right-hand side how the recreational park in Gibson Cove is looking at staggering those opening dates. And again, it is as a direct result of our ability to respond to any concerns where COVID-19 is related. It also was looking at our ability to provide resources. I'll talk about that a little bit more here in a second, but through this amendment to the local state of emergency, you'll see they're highlighted in blue that additional recommendations for the opening of lodging facilities will be forthcoming from the Clay County Health Department. These will include guidelines and recommendations consistent with existing executive orders and the CDC. So when we're looking at what those recommendations are, this is a quick, just again, infographic of flyers that we have ready to post throughout the community. I've been working with the director of the rec department and getting these up, as well as cleaning stations, as well as hand sanitizing stations and mass distribution points. So on the left, you'll see the campground, and on the right is the hotels and rentals. Some of them are a little bit different in terms of guidelines, but again, they are still following the current executive orders as far as mass gatherings and for the hotels and rentals. So let's say if you have a short-term rental, you've got an Airbnb, we are recommending and asking that you advise your guests to bring their own food, to cut down on runs to the grocery store, and to bring their own bedding, towels, things of that nature. We will have an opportunity for you to swing by here, pick up some of these flyers for your properties, as well as pick up masks. So those will be available to you. I am working on some hand sanitizer and things of that nature that you'll also be able to offer your guests. So we're definitely thankful for our partners at IOI for assisting us with this effort, and we're definitely grateful for everything that they have done to help support not only our health department, but all of Clay County government. We've been successful in giving masks to transportation riders, as well as individuals that frequent other facilities. So it's definitely been a win for us, and something we're very appreciative of. Lastly, what I'll touch on is where we are at as a Clay County government and the ways that our commissioners are working for us as this opening continues. So this is a letter that was written to Governor Cooper yesterday, just kind of outlining where we are at, how we are ready to respond, our successes and our wins, and just asking for his support and letting us continue on with these soft openings as time progresses, so that we can do what is best for our citizens, not only with their health and safety, but then also for getting our businesses back and running and getting them back in this new normal. So if you wanted to check out our latest series of videos on our Facebook page, I would highly recommend looking at what we've offered for small businesses. We've had Paul Worley in from Tri-County Community College offering assistance on all of those applications. So you hear about these stimulus monies, you hear about all of these paycheck protection programs, unemployment. There's a lot of information out there, right? And so it's difficult to kind of navigate. So Paul has offered his expertise. That is video 1 in the series that you can find on our page. He gives his email address for him and his colleague so that you can set up an appointment and go through those options and learn what may be best for you, because all businesses are different, and that not only includes from a statewide perspective, but locally, even townships can have different classifications of what a business is and its function. So that is a big recommendation from us, and also getting with Chris from the Ferris Group. So he has a business consulting group there on the square. His contact information is also within those videos. And it's a great opportunity to learn about marketing in this new normal and how to continue on and how to be able to not just scrape by with your business, but then how to succeed moving forward and, maybe even be better than before. So a lot of great opportunities for our business owners. And then if you've got more questions for us, there are 2 ways that are the easiest of getting information to me. You can email Becky Long at the email address. This is publisher@claycountyprogress.com. We are currently on week 7. That is going to be published this week. Week 7 of question and answers about what we were doing as a health department, where people can get tested, how many tests have we done, all of those kind of things may have already been answered. So that would be a great resource for you, as well as the Facebook Messenger. We ask you to please not put any of your questions in the comments because they're easily lost. So please send them directly to Facebook Messenger. So thanks again for joining us. I know it's been a little bit longer than normal, but we appreciate your time, and we look forward to talking with you all again soon.